All right, we're gonna show you guys a demonstration of the cervical spine today. So, of course, we have the DRX9000 for the lumbar spine, and this is the setup for the cervical spine. So you can go ahead and hop on. Yep. Okay, there we go. Lie on your back. Good, and then we're gonna actually slide you down. Keep going. Good. Okay, so the treatment right now is set at 0 degrees, so we never treat at 0 degrees. So this is old school traction where every single patient with every single disc herniation, it's all the same treatment every single time. That's not what this machine does. This machine is going to specifically target each individual disc level. So wherever the patient's disc pathology is where we treat. So in this case, we're gonna treat at C7. That's gonna be at a treatment angle of 17 degrees. All the same principles of the lumbar treatment apply to the cervical treatment. Okay. We're going to go to patient weight. We go max load. The maximum load is typically going to be about 10% of the patient's body weight. We'll start out at 6 to 7% of their weight, depending on what that is. It's hard to feel it around 5 or 6 pounds, so we're gonna set it at 7 pounds and then hit run. Same principle as the lumbar spine. This is the profile on top that we're shooting for. The max load's gonna be 7, the minimum load's gonna be 5, and it's gonna cycle between 7 and 5 pounds for the whole treatment. The design for this is so that there is some relaxation between pulls so that the patient doesn't fight or resist the stretch. That's important because if the patient was guarding or fighting the stretch, it would actually clamp down on the disc and cause increased disc pressure, which is the exact opposite of what we want. We want to stretch the spine comfortably and stretch it enough to where we can reduce enough pressure in the disc to create a vacuum so that we can draw nutrients and fluids into the disc. Remember, the disc has 0 blood supply, so we're trying to bring in the nutrients that the disc needs to heal. Most of that is just clean, healthy fluid, flushing out the bad inflammation in the disc to get the disc to heal properly. So as the patient feels this, it'll ramp up to the maximum, the 7 pounds. It's gonna dip down to 5 pounds, ramp back up to 7. If the patient resists or fights the stretch, the machine is automatically gonna detect it. So we have the measured load here. And if you watch my demonstration here, I'm gonna resist and you'll see a spike. And what is it doing? It's reducing the load way under the pull so that the patient is relaxed. And then as I let go, the stretch comes back on. So this is designed for 2 reasons. Obviously to keep the patient relaxed, but it's also a built-in safety feature so that the patient is comfortable the whole time and it's not painful. If it was painful, the muscles would be fighting, or in this case, the neck, the muscles would be fighting the stretch, and we wouldn't get any therapeutic benefit whatsoever. So the DRX9000 was designed to monitor the patient during the stretch, make sure that it's pulling the correct amount at all times, and if the patient resisted or fought the stretch, it would automatically reduce the load. The other thing is, of course, what we talked about earlier, is making sure that we're treating the exact disc level where the problem is. So if the patient has a C7 problem or a C6 problem, we're treating the appropriate disc. So we're zeroing in on the problem. And that's how the DRX for the cervical spine works. So, just as simple as taking the strap off, and we'll take this out for you, and then we'll bring her up. What do you think? Pretty easy, huh? Your head feel a lot lighter? Does it feel like half a bowling ball instead of a bowling ball? All right, great. Okay.